Hi all. So we have gathered here to discuss about the case study on analog to digital converters. So first we'll see what is A to D converter. So A to D converter is converting an analog signal into a digital signal. So in this you have first process is sampling. So after sampling you will be performing quantization and your analog signal will be converted into a digital signal after quantization. So you have three types of signals, mainly analog, discrete and digital. So in analog you know that the time and amplitude are both continuous in nature. In discrete your amplitude will be discrete in nature and your time will be continuous, whereas in your digital signal both your time and amplitude will be discrete in nature. So first by sampling you will be converting your analog signal into a discrete signal, and after quantization it will be converted into a digital signal. So this A to D converters are used in many applications, like say it is used in digital signal processing, it is used in medical devices, in medical instruments, it is used in audio and video processing. So everywhere you are using A to D converters. Okay, so today let us see an application of A to D converter in your medical devices. So I'll give you a few minutes for discussing among yourselves. So you can take any case study and discuss among yourselves, and you can share your points with each other. Okay, so start your discussion. Have you discussed among yourselves?
Yes, ma'am.
We can start?
Yes,
ma'am. Who's going to start first?
So A to D converter is mainly used in biological systems. We mainly used in the equipment like ECG, MRI scan. In all that we using that A to D converter. So we especially see that biological needs. In biological needs, mainly the equipment of MRI and ECG scans. It is very useful for the patients. And in ECG scan, MRI scan, when that is efforts of the skin, so these are considered to the A to D converters. So mainly A to D converters are used in these biological needs and some equipments.
So, since we are talking about the medical equipments, let me just talk about two different equipments which is very important, which also uses the analog to digital converters. First off, we have this ECG, which stands for electrocardiogram. So this basically what it does means it actually gets all the electrical heart rates, and the heart rates which is emitted from our heart is very weak. So what it does means it has few processes. The first thing is we'll be having electrodes which will be placed in our skin. So through those electrodes, the weak heart rates will be collected, and from that collected signals, it will go to the amplifiers. So amplifiers, what it does is it will boost the weak signals to a strong signal, and after the amplifier, it will go to the filtering process. So in that filtering process, it will remove all the unwanted noises. There'll be like so many muscle movement also, so it will remove all of that. And after that, it will be sent to the ADCs, that's the analog to digital converters. So there, it will digitalize the signals which is received from the filters. So for the analog to digital converters, we need some parameters. So the first of we need is high resolution. So in order for the ECGs to work properly, we need to have a proper analog to digital converter. So to have that, we need to have a high resolution. So from 12-bit to 24-bit, we should have the resolution, and also we should have high sampling rate. From 250 Hz to 1 kHz, we need to have the sampling rate. and also we should have low noise distortion. And coming to the MRI, which stands for magnetic resonance imaging. So what it does means it actually gets all the tiny radio frequency which is emitted from our body through the hydrogen atoms. So the hydrogen atoms emits all the micro frequency when it is exposed to a strong magnetic field. So for that also there are some process. So there we had observers. Here, there we had electrodes. Here we have FR coils. So those FR coils observe all the weak signals and it will send to the amplifiers. Here we'll be using another amplifier which boosts up all the signals and it will be sent to the filter, and after filtering it will be going to the ADCs. And the same process as the ECGs, here also we need high resolution, high input impedance, and also the high sampling rate. So this is all about the working of both the instruments.
Yeah, good. You explained the ECG and MRI working. It's very good. Next, who's going to?
Like we just want to tell about the key performance and parameters in medical analog to digital converters. To function effectively in medical field, ADC must have some things like resolution. More bit provide finer details. For example, 16 to 24 bit like that. For sampling rate, it must be at least twice the highest frequency in the signals. And then for signal to noise ratio, it exposes the preserve from work biological signals.
Next one.
So let's discuss about the future trends of the ADC. So while coming to future trend, the main important thing is AI. So we can include the AI and machine learning to the ADCs to increase the prediction and enhance the performance. And next is most of nowadays used ADCs are wearable, so we can include wireless ADCs. And next is higher integration. So we can include the SoC, system on chip, and microcontrollers to increase the to reduce the size of the ADCs. The trend is towards a smarter and smaller to medical sector.
So I'm here to tell about the challenges in ADC in medical equipments. The first one is noise reduction. The biological signals are converted using the amplifier. The amplifier will convert the outside electronic signals and noise reductions. It will disable all the outside noise signals. And the next one is distortion. It will reduce the noise signals by focusing on the amplifier that's getting from the ECGs and MRI data. And the next one is long-term stability. The long-term stability is nothing but we have to continuously monitor the ECGs and MRIs for a better output. And the next one is patient immobility. We have to monitor the patients because if the patient are disturbed, means the ECG signals may also get a distortion, and it will not get the correct accurate and accuracy.
Okay, good. The points you shared were very useful. So to conclude with, we can say that A to D converters are used in medical equipments, mainly in say MRI and in X-rays, where it is used for converting the analog signal into digital signal. It's also used in patient monitoring like ECGs, like Jenny explained. So in ECG, it is converting a bioelectrical signal into a digital signal. So in many places, you definitely need A to D converters in order to perform analysis and diagnose the diseases. So if it is in a digital format, it will be easy for us to analyze the data. Okay, so thank you for sharing your points.
Thank you.